Intestinal gas is typically caused by the fermentation of undigested food in the large intestine by friendly bacteria. Fermentation produces gas, which distends and bloats the intestines and causes discomfort. Components of food that human digestive systems commonly have trouble completely digesting include insoluble plant fiber, excessive amounts of fructose, milk sugar and gluten protein. Passing gas, dietary modifications and certain medicines can help you alleviate gas pain from bloating. #Getting rid of gas pains naturally. Number 1. Don't be afraid to pass gas. Probably the most straightforward method of alleviating abdominal pain from gas accumulation is getting rid of it bypassing the gas. Most peoples and cultures regard passing gas in public as bad manners, so be discreet about it and go to the bathroom to pass gas. To help facilitate passing gas, go for a leisurely walk outside and/or lightly massage your abdomen in a downward manner, which may help push the gas out of your large intestine. Number 2. Try to relieve the pain by belching. Another way to pass gas, albeit from the opposite end, is by burping or belching. Although you don't make much impact on lower intestinal gas by belching, it can certainly get rid of excess gas in the stomach and upper intestinal tract. Accumulation of air in the stomach can occur from gulping liquids or eating food too quickly, drinking through a straw, chewing gum and smoking. The accumulated air can be relieved easily, quickly and painlessly by belching. Although drinking too much carbonated liquid can cause bloating, a few sips of something fizzy is helpful for promoting belching and gas release. Number 3. Avoid foods that cause gas. Some foods have a tendency to create intestinal gas because they are difficult to digest or contain compounds that irritate the stomach or intestines. Common gas-causing or bloating foods include beans, peas, lentils, cabbage, onions, broccoli, cauliflower, prunes, and mushrooms. Eating too much insoluble fiber, fructose sugar and gluten can also lead to bloating, flatulence and diarrhea. If you love to eat raw veggies and fruit, then eat smaller portions, chew them slowly and allow more time for digestion. Number 4. Eat foods that won't increase bloating and gas pains. Ginger, raw honey, peppermint, chamomile, cinnamon, cucumber, banana, pineapple, fennel and flax seeds, probiotic yogurt, and kale. Number 5. Avoid dairy if you're lactose intolerant. Lactose intolerance is the inability to produce enough lactase enzyme, which is needed to properly digest and break down milk sugar. Undigested lactose ends up in the large intestine and provides a substrate for friendly bacteria to ferment and use as food, which produces gas as a byproduct. Symptoms of lactose intolerance include flatulence, bloating, abdominal cramps and diarrhea. As such, reduce or avoid dairy product consumption if you suspect a lactose intolerance problem, particularly cow's milk, cheese, whipping cream, ice cream, and milkshakes. Number 6. Mix a teaspoon or 2 of baking soda in some water. Gas pains can be caused by acid in the stomach. Baking soda is a base, which will work against the acid to calm the gas pains. Getting rid of gas pains medicinally. Number 1. Consult with your doctor. Aside from eating gassy foods and being lactose intolerant, there are many medical conditions that cause bloating and abdominal pain. As such, if you have frequent gas pains, make an appointment with your family physician and get a physical examination in order to rule out anything serious. Medical conditions that typically cause bloating and stomach pain include gastrointestinal infections, stomach ulcers, intestinal blockage, irritable bowel syndrome, ulcerative colitis, celiac disease, food allergies, intestinal or stomach cancer, gallbladder disease, and acid reflux. Number 2. Ask your doctor about taking hydrochloric acid. Normal food digestion, especially of protein-rich meals, takes lots of stomach acid, which is concentrated hydrochloric acid. A lack of stomach acid production can lead to inadequate protein digestion, which can ferment in the intestines and produce gas. As such, ask your doctor about testing for stomach acid production and then consider taking supplemental HCl if you no longer produce enough naturally. Number 3. Consider taking the alpha-galactosidase enzyme. As noted above, a common reason some foods cause intestinal gas is because the human body can't digest certain complex sugar compounds. Taking over-the-counter products with alpha-galactosidase can help correct this problem because the enzyme breaks down complex sugars before they reach your intestines and start to ferment. Take a tablet containing alpha-galactosidase right before you start eating foods high in fiber to help prevent the gas formation and abdominal pain. Number 4. Try taking probiotics. Probiotic supplements contain strains of healthy bacteria that are normally found in your large intestine. These friendly bacteria can be destroyed by overusing antibiotics, taking laxatives, drinking too much alcohol, consuming heavy metals and getting colonoscopies. An imbalance of healthy intestinal bacteria leads to digestive problems and GI symptoms. If you think you're at risk for bacterial imbalance in your intestines, then consider taking probiotic supplements to get relief from gas pain. Probiotics are safe and commonly found in health food stores. Number 5. Consider laxatives for constipation. Constipation is infrequent bowel movements or difficult passage of stools, which can happen from eating way too much fiber or not drinking enough fluids. Chronic constipation is usually defined as fewer than 3 bowel movements a week for many weeks or months, but most cases of constipation last for just a few days. Constipation can lead to intestinal pain and cramping that's similar to gassy pain, but the cause of the discomfort is often very different. Medicinal treatment for constipation involves taking laxatives, which promote bowel movements. Laxatives work by either bulking up your stool, softening your stool, helping fluids move through your colon, or lubricating your colon. Thanks for watching this video.